And our pop-up is focused on creating more community involvement and research initiatives focused on sexual and gender diverse healthcare. So part of our goals are connecting folks in the UT community and also the Central Texas community that are involved in queer research, LGBTQ focused work, and sexual and gender minority work, both on the research end to let folks know, hey, there are folks from this area that are doing this work, maybe we should connect, but also highlight and create a platform for that. We're also kind of an incubator for current and future projects. Some projects include the COVID-19 and U research, which is focused on LGBTQ healthcare and health circumstances relating to COVID-19 and U. Other research spans from the Dell Medical School through community initiatives and different departments throughout UT. So we're doing some pretty great work, and we'll have some events that are highlighting some of this work through the month of September and October, which will be our pop-up month. So stay tuned if you'd like to join our listserv. The link is below in the chat box. And y'all can get connected with some events. We'll have some keynote speakers who are nationally renowned folks in the LGBTQ healthcare field that will be speaking in October, as well as folks within our community that will be highlighting their work, as well as community members that would like to influence how research is being done. So we'd like to just extend a great thank you to the folks again at LEAP that are about to present. And at the end of their presentation, we welcome any questions or discussion that follows. So thank you again for hosting, and thank you all for joining. And I'll hand over the floor now.
Awesome, thank you so much. Good morning, everyone. Thank you all so much for joining us on this Wednesday morning. We know how busy everyone is considering the school year coming up, so we do really appreciate everyone taking the time out to come and join us today. Before we get started with the official presentation, we're just going to have the undergraduate team that's presenting today introduce ourselves, and yeah, so we're going to go ahead and start that. So I'll go first. My name is Nima. I'm a rising senior at the University of Texas at Austin, studying neuroscience in Plan 2 with minors in Asian Studies and English. My pronouns are she, her, and I'm really excited to be here with y'all today.
Hi everyone, my name is Shilpa. I am also a senior and I use she, her pronouns. I am a biology and marketing double major.
My name is Rosaline. I use she, her pronouns. I'm also going to be a senior and I'm a computer science major.
Good morning, y'all. My name is Shelby. I'm also going to be a senior. I use she, her pronouns, and I study mechanical engineering and government, and I'm starting my master's in nuclear engineering.
Awesome. So yeah, we're going to go ahead and get started. So the title of the project and what we're going to be talking about today, as Yona had mentioned, is called LEAP. So that stands for the LGBTQ plus Equity App Project for Health. And essentially the purpose of our project, which we'll be referencing back to continuously throughout this presentation, is going to be developing a mobile-based LGBTQ plus health curriculum for healthcare providers in Chennai, which is a city in South India. So that's going to be kind of the overarching goal, which includes both our deliverables and kind of our broad-based purpose for this project. Something that's really important to us in regards to our project, and we'll talk about this more in regards to our methodology later, but it's really important for us to constantly recognize that this is a collaboration and a partnership between us here at the University of Texas and with the two international NGOs that we are so grateful and blessed to work with. And those are going to be Sati and Narangal, and those are both located in Chennai, India, and actually have a lot to do with why we chose the region in particular, and they are, because of the changes with COVID-19, are doing all of the groundwork. And so we are really lucky to have them, and we will discuss them more in depth as we head through this presentation. Lastly, this project is funded through Texas Global's President's Award for Global Learning, and so we're really thankful for their support for this project, because through that process has been able to give us the opportunity to do something like this. So awesome. So this is going to be an overview of what our presentation is going to look like today. First, we're going to give some background, cultural and regional background to LGBTQ plus health in India at large. Next, we're going to talk about our community partners. So those are going to be Sati and Narangal, the two international NGOs that I had just mentioned. Next, we're going to talk about methodology and what methods we use both in our research and as we head into the fall with some of our focus groups and interviews. Something important we're going to mention here as well is how our project timeline and how our methods have changed and adapted to the COVID-19 response. And so that's going to be something pretty important that we discuss. Next, we're going to be talking about two of our deliverables, and those are going to be both the curriculum that we're delivering and the medium we're delivering it through, which is the mobile application. Next, we'll be talking about long-term project goals, so not only within the scope of our project, but what we hope is the impact of our project as we all graduate in 2021. And then lastly, we're going to be talking about interdisciplinary research. So as you can already tell, there's a variety of majors just within the undergraduate team, but we're going to be talking more about what it's like to work with undergrads from different majors, but also faculty and graduate students from different majors, and how we were able to successfully, I hope, work together as such a large team. Awesome. So we're going to go ahead, like I said, and give some background on the project. So in a historic ruling on September 6, 2018, India decriminalized homosexuality, and this struck down Section 377 of their penal code. And so that sets that legal victory, and the reason I mention it first and foremost is because it sets the background for the backdrop, really, for this project, and the reason that this project is able to gain as much traction as it has. So despite the fact that this legal victory happened, as we all know, many of the negative social impacts that had been enacted and resulted from Section 377 staying in place had created this culture of stigma, which affected every aspect and quality of life for India's LGBTQ plus population. So what we wanted to specifically explore, and we were able to do this because of the legal victory, is what are the existing barriers to care and unique health challenges that prevent the LGBTQ plus population from comfortably seeking and accessing in general these essential healthcare resources. And what we found, both through our literature review, which consisted of us reading not only academic literature, but also blog posts and articles that were published online in various news outlets, movies and books as well. What we were able to gather from all of that literature is we were able to see that one of the largest gaps is healthcare providers are unaware or untrained to provide not only culturally sensitive care, but inclusive care as well for LGBTQ plus patients. And so, like I said, again, with all of this information, the purpose of this project unfolded itself. And as we discussed with both our faculty and our international NGOs, we wanted to make sure that we were finding a gap that exists and addressing the gap in it of itself. So I think something that was really important to our team overall is ensuring that the goal of our project was not something necessarily that we only saw from our literature review, but was something that was collaborated on consistently with our international NGOs. And so working with both Sathi and Narungal and with the team at large, we were able to find that what we wanted to do was shift the responsibility onto healthcare providers to educate themselves. And therefore, what we did is we are leveraging technology in this project, and we're using it to develop an app and deliver this health curricula for Indian healthcare providers so that they can work more effectively with LGBTQ plus patients. And so this app is able to offer this adapted LGBTQ plus health curriculum. And I say adapted because while we were able to find a lot of beneficial content from an American context, it was incredibly important that we were able to adapt it to make it culturally inclusive and culturally relevant, right, for the region. And so within this health curriculum, we have both interactive learning modules and content in general about the diverse LGBTQ plus health needs in Chennai. And so that is really an overview and background on our project. And we're going to go ahead next and kind of talk about what we found in our literature review in regards to the 3 aspects of barriers to care. Awesome. So like I said, there are 3 aspects that we're going to go ahead and talk about. And the first one is discrimination. The second one is lack of knowledge among providers. And the third one is stigma. And the reason we want to talk about this is not only to kind of disseminate information, but also in order to show kind of the thought process behind how we chose our point of intervention and how we chose what to focus on. So first and foremost, one of the barriers to healthcare access is going to be just discrimination. And as you can see, you know, we know how heteronormative gender norms ostracize folks at large and provide basis for institutional discrimination of the LGBTQ plus population. And we found through our literature research that that was also present in Chennai as well. The next is going to be fear and anxiety. And I think that that is not only propagated by these institutions that we have been talking about, but also by more social contexts as well. So maybe that includes friends or families, but those communities as well can also utilize fear and anxiety against the LGBTQ plus population in many aspects of their life, but in particular, we found that this was true for inhibiting access to healthcare. The next is going to be social deviance labels. So this one I think is self-explanatory, and that's going to be just deviating from what is considered the norm. And like I said, with gender norms being an example of this, this is a way to utilize power and exercise it against the LGBTQ plus community in order to prevent access to care. So the next one I'm going to talk about is lack of knowledge among providers. First is going to be mental health. At large, mental health is still stigmatized at large globally today. And through our literature review, we've been able to find that mental health is also incredibly underserved, or is very hard to access, for the LGBTQ plus population. That could be exacerbated by some social forces as well, including the family unit and perspectives of mental health within Chennai, India as well. Next is going to be physical health. I kind of already talked about this before at large, but that's just going to be general practitioners and also, specifics in regards to OB-GYN and endocrinology and being able to have access to see those specialists as well. Lastly is resources and training. And so this is going to be on part of that providers themselves. If people know that the people that they're seeing don't have the resources and training to address their specific health challenges, then they're not going to go and access healthcare providers, even if they might have access to them. So that's something really important that we wanted to highlight. Next is going to be stigma. And so I've addressed a lot of these as well, including access to mental health services. And the stigma associated with informal health practices really just lies with some back channels that a lot of folks use in order to get procedures done, or such as gender affirmation surgery. And I think it's really important for healthcare providers to be educated about the fact that a lot of folks might be accessing informal health practices in order to get the affirmation that they need, and also to just get access to things that they would otherwise not have access to. And then lastly, in regards to stigma, is just the recognition of LGBTQ plus identities at large. As we all know, just because something has been legalized, in addition to, for example, the legal victory of striking down Section 377 in India, it does not mean that healthcare providers are going to now affirm LGBTQ plus identities. And so that's a constant barrier that we see throughout this project and throughout our discussions with community members. So overall, this is kind of the large scope picture that we see with this project. Our point of intervention is lack of knowledge amongst providers, specifically in regards to the resources and training, just because that is what we could do in scope of this project, and that's also what we could do in regards to feasibility and have the most impact in regards to the long term. And we're hoping with that point of intervention, things such as discrimination and stigma, which are very large, broad concepts, are able to be addressed. And so that is really the overview of our project.
So as previously mentioned, discrimination in its many forms, which includes legal, employment, housing, along with cultural stigma, really act as barriers that prevent individuals from accessing quality, affirming, and affordable healthcare. And while decriminalization and some other rulings brought these issues to a national and international forefront, many of these inequities that are deeply ingrained in social structures have continued to persist in India and elsewhere. So in light of all of this, it becomes especially important to acknowledge the work that's being done on the ground by community organizations. Many of these organizations are collectives, so they're organizing community members to advocate for LGBTQ plus rights through political and social activism, through research and education. Specifically through this project, we have had the opportunity to work with two incredible NGOs based in Chennai, Sathi and Narangal. You can see their mission statements on the slide, but both of these organizations are really focused on creating an environment for inclusive LGBTQ plus health in Chennai and also other regions in India. And we mentioned this partnership and bring it to attention, especially here, because that this collaboration is really the crux of our project. Our methodology lies in this form of research known as community-based participatory research, which essentially means that we are involving the communities that we hope to serve through all stages of our project. So, they're not just, at the end, but actually, from the beginning, really involved and stakeholders in what we're doing. And this is especially important because we are led and guided by the people who best know the social systems and structures that they operate under, that they experience, that they live through. And so that is a huge part of why we are able to ensure in a lot of ways that the research that we're conducting, that the curriculum that we're building through this is culturally grounded, is relevant, and fills a direct need for among the community. And part of what makes Sathi and Ramgul especially special collaborators is their network of both community members and healthcare providers. And that's especially important for our project, which is, creating this app for healthcare providers to be using and to educate themselves. And additionally, given the fact that so many of, research projects, social impact projects, grant funding is often geared towards cities in the north, like Delhi, the opportunity to work in South India, where a lot of these resources are not always first initiated, has been really impactful.
Okay, sorry. Yeah, so Nima and Shilpa have done a really great job of introducing the background of our project and sort of setting the background for the environment and the context and culture in which this project is taking place. So I'm just going to talk a little bit about how it actually looks like to be implementing our research project, the methods that we were using, and the frameworks that we were considering, just like what it looks like on the ground to actually implement this research project. So the big thing that we wanted to talk about, as Shilpa mentioned, is community-based participatory research. And that's something that we really wanted to keep in mind during the entirety of our research process. And it was something that was pretty clear how it was going to be implemented and how it was going to continue to be implemented, since through our grant that we won through Texas Global, we were going to be able to have the opportunity to travel to India and really interact with our community partners and with the community itself and with the healthcare providers. However, because of recent events, obviously we are not in India and we cannot travel to India. And so the big question was really like, how can we ensure that community voices are still being heard and still an integral part of this project? And how can we continue to implement healthcare provider feedback into every stage of this planning process? And so a lot of this project has just been us learning to adapt to the virtual environment, us trying to figure out how to do health work within the context of this big global pandemic, and also just figuring out like how to be flexible within a research project at large. So I'll talk a little bit, I'll start from the beginning and I'll talk a little bit about the timeline of what we've been working on. So the very first thing that we did when we were, we hadn't even known that we were going to do the project yet, we were just writing our proposal, was we started our literature review. And so the literature review has been crucial to ensuring that we have a really good understanding of the actual needs and circumstances of LGBTQIA+ patients in Chennai seeking healthcare. And so obviously, Nima mentioned earlier, we looked at blog posts. And so that was part of our drive to not only look at traditional academic sources of literature, but also more culturally relevant pieces of literature, just so that we could get a more comprehensive view of the entire circumstances surrounding LGBTQIA+ patients looking for healthcare. And so in addition to looking for blog posts, we watched films, we read books, and just we looked through a lot of more untraditional, non-traditional cultural pieces, as well as obviously looking through traditional articles in peer-reviewed journals. So that was just like a really, really important piece. It was really important for us also to be able to supplement the traditional academic side, because there is a dearth of information about the LGBTQI+ community, specifically within a health context from the India side. And so we wanted to ensure that, again, as Shilpa mentioned, we found a lot of resources from the US, but we wanted to ensure that everything we were doing was inclusive and relevant to what was actually happening on the ground in India. And so the plan for this summer was that we were going to go to India to conduct interviews and focus groups. And so obviously things change, and we sort of had to figure out like how do we ensure that we can still conduct these interviews and these focus groups that are going to be so integral to refining our curriculum and making sure that we're being sensitive and inclusive in every stage of this research process. So the solution that we've come up with, and we've had to rely super heavily on our NGO partners who have been phenomenal in helping us set up these interviews and reach out to both LGBTQI plus community members, as well as healthcare providers. So a variety of people within the healthcare sphere. So not only primary care providers, but also peer counselors, mental health care providers, anybody who might be involved in that general healthcare sphere, treating people, treating queer patients. And so the plan right now is for us to do virtual interviews and virtual focus groups this coming fall. And so the interviews we're planning to do with healthcare providers and community members. And that's really going to help us get a sense of what healthcare providers understand and don't understand, and what they're thinking about and not thinking about when they're treating LGBTQIA plus patients, which will be essential to making sure that we're accurately meeting all of the gaps in knowledge that exist right now within the healthcare curriculum, but also in making sure that even we're also addressing the needs that healthcare providers might not necessarily know about, but that the community themselves have said are relevant and are in fact present. With focus groups, we plan to do both English language and Tamil language based focus groups. Tamil is the language that is spoken by many people in Chennai. And so that's also just going to give us a chance to speak to a broader subset of the queer community in Chennai, and we're really thankful to have our NGO partners to help us assist with that aspect of the focus groups. Finally, we'll be working on app testing and curriculum refinement. So we actually do have a working app prototype and website prototype. Obviously, they'll need to be refined, but they are both in fact live. And so what we're really hoping is to be able to use feedback from our virtual interviews and virtual focus groups and integrate that into our curriculum, as well as integrate that into the actual creation of the app itself. It's pretty clear to see how that feedback would be implemented into the content of the curriculum. Obviously, like, we're really just hoping to be able to include community voices and really create a curriculum that is actually reflective of what community members say are issues and what are not issues, and what they really want healthcare providers to know. But also, like, it will be so important in building this app, just because the goal for our application and for our website is really to be able to provide information to healthcare providers in a user-friendly and effective way. And we're hoping that by piloting and testing the app with community members and with healthcare providers, we'll get feedback on is the app itself, like the actual environment in which this content is housed, is it user-friendly, is it accessible, is it conveying the information in the way that we want it to be conveyed? Because especially in a digital environment, we have to be really mindful of not only the information that we're presenting, but how we're presenting that information. So the plan for right now is to conduct the virtual interviews and the virtual focus groups in the fall, and then after that, begin to start integrating that feedback into our products and our curriculum.
Also, I'm going to talk a little bit about two of our main deliverables. So I'm going to start off with curriculum development, and there's obviously some words on the slide that you feel free to read while I'm talking to them. But first of all, on curriculum development, we kind of split off into two little teams. As you might have heard before, Rosaline is our app developer, so the curriculum development really fell on those of us who don't have that computer science background. And we, along with our community partners, which was really important for us, we came up with a list of about 9 modules that we felt like, and with from our community partners, would cover a general list of topics that healthcare providers would be able to use to get a general understanding of the LGBTQ plus health kind of environment and what's kind of missing from the current care that's being given. So some of those modules include things that are more general, such as addressing and confronting bias, talking about implicit bias and how to recognize that, to things that are more specific, where we have a module on transgender healthcare, and we're actually working on creating a module on intersex healthcare after a call with our community partners, where that was brought up as kind of a gap that we could write a general module about. And like I said, we're all undergraduate students, and we kind of did the first pass at these curriculum modules. And so they're not supposed to be teaching healthcare providers about like very, specific health needs. They're more of, these are some gaps or like some introductions to different topics that the community has identified would be really important for the healthcare providers to start recognizing. And then we also are going to be providing links to further resources for the healthcare providers to kind of look at afterwards and gain a deeper understanding. It's kind of supposed to be like a moment where a light bulb kind of flips on, oh, this is something I should learn more about to help have better care for my LGBTQ plus patients. And as I mentioned, like even from just the get-go, we have been in constant communication with our NGO partners about the curriculum modules that we're working on, but we also are going to have them in the app in both. We're going to have it both in English and Tamil version of the app. And so right now, our grad student, who's actually on the call, who's amazing, is working with our partners to start translating some of the modules. And that's really great because it's kind of a back and forth conversation and learning, oh, well, this module that was written by us in a more maybe American view won't work for the community. And so it's going to be an iterative process to update these modules to ensure that they are culturally relevant and not too westernized or just focus on the American healthcare aspect. And the last thing on the curriculum development I'll mention is, like I said, we worked through, or like it's been mentioned, we had a literature review at the beginning that was integral to even this, but we leveraged a lot of resources for these modules, and both including our literature review as well as other kind of online healthcare-based modules and things like that to kind of get a sense and a feel for what we wanted to do with them. And we're hoping after our focus groups and our interviews that we'll be able to constantly, and through the translation process and with our NGOs, we'll be able to constantly kind of update it throughout this year so we have the best modules that we can have before we pass it off to our community partners. And we're hoping to add some interactive aspects and maybe different voice snippets to kind of really make these modules connect with the healthcare providers who will be going through them. The second part I'll talk about, and this is where, to give Rosaline a lot of credit, this was Rosaline's domain, but it's our mobile application. So part of the reason we kind of focus on a mobile application, and we also have a website, which is awesome, is actually India leads the world in accessing the internet through mobile phones. And so we focused on building an Android mobile application because we figured that that's probably one of the most accessible ways we can get this information out there. It also will hopefully serve a really great purpose in if a healthcare provider is, super busy having visits, multiple visits or a ton of visits at a time. Let's say they have a visit with a patient and they think, or they have an upcoming visit that they notice and they think, oh, maybe I remember reading about bias or whatever topic, or transgender health or something like that, but I forgot I want to research. They could real easily pull up our modules on their phone or whatever they have and click through to see whatever the topic was. But our mobile application is built to be super accessible to the user, Rosaline, and we actually were able to hire two other undergraduate students to work with us who did amazing work as well. One I think helped out with the actual development of the app, and one is who helped out with the whole design of the app and the website, which are very nicely designed. But the whole point of it is for it to be very user-friendly. We have an index built in. There's a table of contents for every module, so it's really easy to click through. We also have, we're hopefully going to be adding links to the end of all of the things, but basically it's just a very great platform, and the team did a really great job in developing it for it to be super easy to use, and we're hoping when we pass it off to our NGO partners, it will be super easy to keep updated as well. But yeah, that's about all I have on our two deliverables.
Before delving into some of the long-term project goals, I want to address why this project really matters. So when we look at health equity, we realize that gaps in health, in healthcare access are present globally. They're large, they're persistent, and they continue to increase every day. And a lot of these gaps are actually caused by social structures in place. And it's really hard to be healthy, to stay safe when you don't have access to, good housing, good economic security. There are all these interplays that affect health. And even more importantly, our cultural filters and our identities also shape the way that we understand and pursue health, where we seek help, and the types of treatments that we hope to get. So when we look at all of this, this really helps, I guess, frame our perspective of what health equity means, which is providing everyone with the opportunity to live and lead their healthiest life, no matter who they are, no matter their background, where they live, their income. And that is really what this project as a large is, in a small way, trying to address, is the importance of achieving health equity. We, through this project, we realize that there are so many systemic barriers. People's fundamental identities are a huge reason why they're being denied healthcare, why they're not able to comfortably seek it, and might stay home instead of going to secure treatment for some kind of illness or disease. So when we looked at those barriers, and even though our direct point of intervention is trying to educate healthcare providers, at a very large scale, we're hoping that this can create conversations that help to address some of these really ingrained sources of stigma, of just lack of knowledge and unawareness that exists in society. So that kind of falls under the umbrella of educating providers. And it's not just healthcare providers, but also all members of a comprehensive care team. A patient's experience in terms of accessing health begins when they walk into a clinic or hospital. So it also includes, front desk staff, the nurses, really all people who interact with a given patient. And given the fact that also there is no standardized or consolidated LGBTQ plus health curriculum that exists either in India or in the US, for that matter, we're really hoping that this demonstrates small ways that these issues can be integrated into further medical education and curriculum. Beyond this, we're also hoping that our project can just expand the scope of current research. We mentioned that our literature review relied on a lot of different sources, not just peer-reviewed academic journals. And part of the reason for that was because we needed that supplemental information. There was just a big gap in literature about LGBTQ plus health. And then when we go even narrower in India and in South India in particular. So as that funnel, as we went down that funnel, we found it harder and harder to gain access to resources that and data that kind of addressed all of this. And so, especially given that so much of research traditionally is centered around white, male, heteronormative populations, cisgender populations, it is really important to provide avenues to continue exploring LGBTQ plus health and health for other underserved communities in its very many diverse forms. And beyond this, with an application, with an app, one of the cool things about it is that it is scalable and has the potential to be used widely. Our hope, and this is also the goal of our NGOs as well, is to adopt this in Chennai, but also find ways to continue using it in other workshops and trainings beyond that city. So we're really excited to see where and how that can manifest. And lastly, this has just the opportunity to work with 2 international partners throughout this process has been so instrumental, so valuable throughout our research and curriculum development process. Sathi and Rangal have been doing and continue to do really incredible work to advocate for and support LGBTQ plus rights in health and other fields, because they all are interconnected. And so we really hope that that our collaboration can continue to extend even beyond when the 4 of us graduate, that it's the start of a new and long-term partnership.
Okay, I'm going to talk a little bit about interdisciplinary research and kind of how our teams work. I'll try to keep it brief so we have some time for questions. First of all, before I start talking about what it's like to work on such a big team, I would like to shout out that we do have most, if not all, of our faculty and our grad student on this call, and they are absolutely integral to this project. I don't know if we mentioned it before, but all of them kind of believed in us before this project really got off and started, and have been there throughout so many challenges and changes. And so we're very grateful for all of their support and for just working with us and providing their knowledge to us. But I'll talk a little, and you can see we kind of called out all of their names. So we have, between the undergraduate students and our faculty, we have 5 of different schools at UT covered, and it's been such a valuable experience to work on such a diverse team. So I'm going to kind of skip talking about the undergraduate part, but learning from our faculty, I think, has been a very valuable experience for us. We have had weekly meetings with our faculty and our grad student since beginning of the spring semester, basically. And every meeting we come in with either questions, or we get to have these amazing discussions where we learn more about our project and we're able to expand the scope. If you had seen our project when we first were proposing it in the grant phase, you can really see the impacts of this working in such an interdisciplinary team. I think at the beginning, we maybe talked a little bit about interviews, and now we've really expanded the interviews and the focus groups to really understand how we can get more community insight through those, and kind of using different social science research methods that we may not have been exposed to before. We also have Dr. Hamilton Solom from the School of Nursing on our team, and she's been an invaluable resource for an insight into the healthcare setting and the nursing setting. And like every time we're able to talk about, oh, well, this is how that would be perceived, or that kind of stuff on our modules, and kind of get it from a healthcare provider perspective, in order to make sure that the way we're delivering our content and the information is in a way that healthcare providers will be receptive to. Of course, we have Dr. Toprak, who's worked a lot with Rosaline on the app development. And he's been, I think he's been with our project since the very beginning, and before, like I said, we even really had a full project. We're very thankful for having him on our team and helping us with the app development side. And Dr. Rudrapa is from sociology. She's our lead professor. And like I said, with focus groups and all of that, she's also did a really great job of introducing us to new material throughout the project that helped expand our worldview and our view of the area and of not only LGBTQ plus healthcare disparities in India, but other populations and other intersections with that that would have an impact on our project. And then of course, Ani, our grad student, we are very thankful to have had him on board throughout our project. I think he's actually getting ready for his first semester at Princeton, but he's actually worked with the two NGOs, and they recommended him to us. We were recommended Ani from so many different sources, and I really think having him as a member of our team has helped us ensure that we are as connected to our NGOs and the community as we can be, and making sure that we're grounding our research and everything that we're doing in that kind of goal of it's not a project that we're doing just to do a project or to deliver something that the community doesn't need. It's the project we're doing to work with them and deliver something that hopefully will continue to be used and is providing value past when we're even working on it. So it's just been an honor, I think, and I think all of the undergraduate students will talk about it, would say this, to work on this team and to be surrounded by so many people who care so much about what we're doing and who are able to provide their expertise and their advice and their support throughout the whole project. I don't know how I'll be on a team that has worked as closely as we have before. And I think if you ever have a chance to work on a team with the interdisciplinary mix, it just brings your project or whatever you're working on to the next level, to have all of those background perspectives, to help make sure that you're actually meeting, like our project's a very interdisciplinary project combining technology, healthcare, different social stigmas and that kind of stuff. And so I think it's important to have all of those perspectives while you're doing that. But yeah, that's about all I have on that. We're just very thankful.
Yeah, Shelby kind of covered her bases with this, but we wanted to, extend a formal thank you to, our faculty, graduate student Ani, to our community partners, Satya and her uncle, and to our faculty advisors. So these are people who we've consulted on with the project. Obviously, Dr. Norwood, who you all know from the Pop-Up Institute, she's been really invaluable to us, and Dr. Philip Schnars, who helped us with sort of coming up with the project idea in its very early stages. So we just wanted to thank the Pride Health Pop-Up Institute at large and Texas Global for this opportunity in general.
That concludes our presentation. If y'all have any questions, feel free to ask, but thank you so much for coming. We really appreciate the opportunity to share our project, our progress with y'all, and yeah, we're just happy to answer any questions that you may have.
Thank you all so much for sharing. This has been such an illuminating research project. It's so informative, and also just to see all this great work that y'all are developing. It's very inspirational. So thank you for sharing, first of all. I would like to just be cognizant of our time here. We're set to end at 11, but I'm happy to stay on for a little bit longer. But if folks need to leave, just know that we are recording this. So if you have to leave and you'd like to hear more about the question and answer period, then you can always reach out to our website and you can see the recording later. I'd love to ask y'all what kind of challenges you foresee going into this virtual focus group session. So y'all were mentioning how your next steps would be to help trial the app development through virtual focus groups. And it seems like there are so many different issues that may arise. And I'm just wondering, how are y'all foreseeing potential issues and how to navigate a virtual app development?
I think one thing that has been really valuable in terms of trying to figure out what that methodology would look like has just been consulting with our partner organizations about even just like the very simple things of what platform do we use. Zoom is not always the most conducive for a lot of different reasons, and with an online setting we also have to worry about consent, or we have to also be mindful of consent and privacy and how to secure all of those. So just logistics has definitely been a challenge, and we are in the process of figuring that out. Actually, trying to coordinate all of that. In addition, our app is targeted is the audience for our app is healthcare providers, and right now during a pandemic, these are the frontline workers who are who are so busy and in so many different ways right now, especially. So I think that's like another huge thing that we are very aware of, is that like a lot of things might not be as feasible as we had first imagined to be. Like we might have to reduce the number of interviews we do with healthcare providers at this moment, but that doesn't mean that they might not be done at a later time. And we might draw more heavily from the insights from community members and other individuals who, because the pandemic has had such disproportionate and extreme impacts on different groups, also being sensitive to those needs as well.
Also, feel free to write questions into the chat box. Well, in that case, I'd like to thank you all for joining in and sharing your research with us. We all really appreciate it. And for all the participants and viewers, thank you so much for joining in. Again, you can reach out if you need to. And it looks like y'all have posted a website that y'all can extend any of your research info if people want to learn more about it. So that seems to be in the chat box as well. And if that's all right, we'd also like to post that on the pop-up website. So thank you so much for adding that link as well. Wish you all the best of luck with the continuation of this project, and we hope to get an update and share that with folks as y'all progress. So thank you again so much. Really appreciate it.
Thank you.
Thank you so much. Yeah, thank you all for coming.
Thank you.
All right, with that, we're just gonna end it. Thank you so much and have a wonderful day, y'all.
Thank you.